Assalamu alaikum. I'm Dr. Abia Sadat from Anatomy Department, Sahara Medical College, and today I'm going to discuss the general anatomy of skeletal muscles. In the previous lecture, I have already discussed the general features of a skeletal muscle and also some microscopic features, that these are long cylindrical muscles, multinucleated, they show striations and are non-branching and are under the voluntary control. So that is why different synonyms here used for skeletal muscles are striped muscles, striated muscles, somatic muscles, and voluntary muscles. In this first section, I'm going to discuss the structure of skeletal muscles and structures associated with skeletal muscles. And in the next section, I'm going to describe the different criteria through which skeletal muscles are classified into different categories. Skeletal muscle as a whole has two parts. The fleshy part, which consists of the contractile muscle cells arranged in groups, and then the fibrous part is the non-contractile and inelastic part, which is made up of collagen fibers. It may be cord-like or rope-like, which is also known as tendon, and it may be flattened. It is called aponeurosis. So talking about the internal structure of a skeletal muscle, we can observe that the whole of the skeletal muscle, which is usually surrounded by a connective tissue layer called epimysium, is shown here. Epimysium is attached or blended with the connective tissue sheets covering the outer layers of skeletal muscle, which are usually the layers of deep fascia. Then we can observe in this section that the skeletal muscle is made up of bundles. These bundles are known as fascicles, and each fascicle is surrounded by another layer of connective tissue, which is called perimysium. Epimysium and perimysium both are dense irregular connective tissue layers, but epimysium is a bit denser than perimysium if we consider the histology. Then we can observe that in each bundle the skeletal muscle cells are packed. The skeletal muscle cells or fibers or myocytes are also called myofibers. They individually are surrounded by another layer of connective tissue, and this time this is the loose connective tissue surrounding the skeletal muscle cell, and this is known as endomysium. Epimysium, perimysium, and endomysium, they conduct the branches of the neuromuscular bundle from the outer surface towards the individual muscle fibers, and at the level of endomysium we can see the capillaries which are supplying individual muscle fibers. So discussing the parts of skeletal muscle, it has two ends, an origin, which is usually the proximal part of a skeletal muscle, and in majority of time it is the fixed part during the contraction, while the other end is the insertion point, which is on the bone after the skeletal muscle has crossed a joint, and this part is the movable part during contraction. Previously, these terms were used for the proximal and distal attachments of skeletal muscle, but now these terms are not frequently used, as skeletal muscle can act on both sides by fixing any one of the point of attachment. So these are now vague terms. There are different modes of skeletal muscle attachments. Either the fleshy part is attached to the bone directly. In that case, the layer of epimysium is blended with the periosteum of the bone. Examples are the intercostal muscle. Their proximal and distal attachment both show direct attachment of the fleshy part to the bone. Muscles are also indirectly attached via cord or rope-like structures which are called tendons. For example, we have bicep brachii, which is attached to scapula on one end and to radius on the other end. Then the epimysium of the muscle that passes over the tendon is epitendinium, and this layer is blended with the periosteum. Then muscles are also attached via fascia or tendons of another muscles. For example, lumbricals, their origin is attached to the flexor digitorum profundus in upper limb, and the lumbricals in the lower limb are attached to the tendons of flexor digitorum longus. And their insertion is attached to the fascia like expansion of the extensor digitorum, which is called extensor expansion. So this muscle fits in both criteria. In head and neck, some muscles, they are inserted in the fascia, superficial fascia, and these are the muscles of facial expression. In abdominal wall, anterior abdominal wall, we observe sheet-like muscles which end up in sheet-like connective tissue parts which are also dense regular connective tissue just like tendon. These are known as aponeurosis, and we have examples of external oblique, internal oblique, transversus abdominis and abdominal wall. Other than tendon and aponeurosis, sheath-like connective tissue layers called fascia are also associated with skeletal muscle. The layer of fascia lying just underneath the skin is known as superficial fascia. This is also called hypodermis. The superficial fascia has an outer fatty layer, the thickness of which varies according to the gender or the region, and the inner layer is membranous. In head and neck, some skeletal muscles are present in this layer. We have already mentioned the muscles of facial expression present in there, and the neurovascular structure related to these structures are also present in this superficial facial layer. The deeper layer of connective tissue is the deep fascia, and it is a thick, dense, irregular connective tissue sheet which is not only covering the entire region just under the superficial fascia, but it is also sending connective tissue septa which are attached to the bone, and they divide the region into compartments. For example, in upper limb and lower limb, we have different compartments. These compartments not only divide the region into functional groups. For example, there is an adductor compartment, a flexor compartment, an extensor compartment. These compartments also keep the skeletal muscle within their region, and also are responsible for increasing pressure over the veins when the muscles are contracted within a compact environment. At the level of wrist and ankle, where the long tendons of muscles present in the forearm and leg are passing over to hand and feet, deep fascia thickens to form retinacula, which are going to keep their tendons in place and also protect them. In some regions, the deep fascia is further thickened to support the compartments like iliotibial tract, which is thickened lateral part of the thigh fascia, and it provides attachment to muscles like tensor fascia lata and gluteus maximus. Then in palm and sole, the deep fascia is thickened to form palmar and plantar aponeuroses, which are going to protect the deep structures, also providing the mean of attachment to the small skeletal muscle present in these regions. Nomenclature of skeletal muscle is based on different criteria. For example, according to size, the skeletal muscle in some region are named as major or maximus when they are large. For example, pectoralis major, gluteus maximus. When they are intermediate in size, they are called medius, like gluteus medius. When they are small, they are called minor or minimus, like pectoralis minor, gluteus minimus. Then when they are broad, they are called latissimus. When they are long, they are called longus, and when they are short, they are called brevis. For example, peroneus longus and peroneus brevis. According to Actin, when they are flexors of the digits, they are called flexor digitorum. When they are extensors, they are called extensor digitorum. Then according to position, they are named according to the region where they are present. For example, the muscle present in pectoral region are known as pectoralis major and minor, for example. Then in gluteal region, they are called gluteae. Then according to depth, the superficial muscles may be named as superficialis, and the deep ones are named as profundus, or the superficial can be named as external or externus, and the deep ones are named as internus. We have examples from thoracic muscles, the external intercostal, internal intercostal. Then we have examples in upper limb, which are flexor digitorum superficialis, flexor digitorum profundus. According to the number of heads, they are classified as biceps, which are two-headed muscles, triceps, which are three-headed, quadriceps, which are four-headed. Then according to attachment, some muscles are named, for example, coracobrachialis, which is starting from coracoid process and attached to the bone of brachium, which is humerus. So this is called coracobrachialis. Similarly, brachioradialis, which is starting from brachial bone or humerus and is attached to radius. Then according to shape, when the muscles are delta shape or triangular, inverted triangular, they are called deltoid muscles. Then if they are rounded, they are known as teres, and when they are straight, they are called rectus. When they are quadrangular, they are called quadratus. So these are the criteria of nomenclature of skeletal muscles. So the action of skeletal muscle require large amount of oxygen and nutrient supply. So we can observe that skeletal muscles are highly vascular structures, and here we can see the neurovascular structure entering the skeletal muscle through almost the same point, which is called the neurovascular hilum. And here they are further distributed, and the branches are entering the different connective tissue layers. Muscular arteries distributed over the epimysium, branches of which enter the further layers, which are perimysium, and when they reach the cellular level, they form networks of capillaries all around the muscle fibers. Then each muscle fiber is supplied by its own axon terminal, forming the motor end plate. And so each muscle fiber is individually innervated and activated by individual neuromuscular junctions. So the skeletal muscles, they are acting at two levels. The voluntary action of the skeletal muscle is controlled by our higher nervous system, and that is conveyed by the motor fibers. Skeletal muscle are also supplied by sensory fibers. The motor fibers are 60% and the sensory fibers are 40%. These sensory fibers are responsible for completing the sensory component of the reflex arc, as we know that skeletal muscle can involuntarily be involved in reflexes. Then autonomic fibers that are supplying the blood vessels of skeletal muscles, they are also present in these nerves. Sensory nerves are also there as the skeletal muscle activity is monitored and the feedback is given to the higher centers. Skeletal muscle have regular fibers which are called extrafusal fibers, which upon innervation by the motor nerves contract and relax. Other than that, there are modified skeletal muscle fibers which are covered by a special connective tissue sheath, and they are not only supplied by the motor nerves but also supplied by the sensory nerves. These are known as neuromuscular spindle. The muscle spindles, they basically contract and relax with the extrafusal muscle fibers, but the length of these muscle fibers, which are also known as the intrafusal fibers, is monitored, and the message is conveyed to the higher centers, which are there to monitor the muscle length. The motor fibers which are supplying these neuromuscular spindles are known as the gamma motor neurons. So among the bundles of regular collagen fibers, the tendon also contains specialized collagen fibers which are enwrapped by connective tissue sheath or capsule, and they are also supplied by sensory fibers coming from the nerve supplying that muscle. They are known as Golgi tendon organs, and they are the receptors for monitoring the tension in the tendon, which is produced during muscle contraction. The sensory information is passed on to the posterior gray horn of the spinal cord. From there, they are also conducted to the higher center. Also, for the reflex activity of the skeletal muscle, it is connected to the anterior horn neurons, which are the motor neurons. Large fibers from these neurons form the alpha fibers, which are supplying the extrafusal muscle fibers, while small myelinated nerve fibers from these neurons, they form the gamma neurons supplying the intrafusal fibers. And one axon, which divides into its terminals and supplies the muscle fibers, forms one motor unit. Here in this diagram, we can observe axon exiting from the cell bodies present in the anterior gray horn. There are two types of axons, the axons of alpha motor neurons and axons of gamma motor neurons. You can see here the unit 1 and 2 showing the motor units of those alpha and gamma motor neurons. Now looking at this terminal, we can observe the presynaptic part of the neuromuscular junction, which is formed by the axon terminal. Here you can see the dilated part or presynaptic bulb, and we can observe the synaptic vesicles which contain the acetylcholine, which is released here in the synaptic cleft. The sarcolemma of this part of the muscle is going to form the postsynaptic plate, and it has receptor for the acetylcholine, which is released from the nerve terminal. And after the acetylcholine binds with the sarcolemma, it generates an impulse, changes in the ion channels, and that generated impulse is conveyed to the T-tubules from the surface sarcolemma. T-tubules also convey this change to the sarcoplasmic reticulum, which is going to release calcium stored in it, and then the muscle contraction starts. At microscopic level, we have already observed that a myocyte or a skeletal muscle cell is striated, and it has a cell membrane which is called sarcolemma. The nuclei are peripherally located, and these cells are multinucleated cells. The cytoplasm is called the sarcoplasm, and longitudinal myofibrils, they show patterns which are seen here as dark and light bands. Also in the cross section, we can observe the dots which represent the myofibril sections, and the nuclei which is lying close to the sarcolemma. At ultramicroscopic level, we can observe that the muscle cell is composed of myofibrils, which are placed longitudinally. These myofibrils consist of proteins, which are also known as myofilaments. The thin proteins are known as actin, and the thick proteins are known as myosin proteins. There are also other proteins which are responsible for binding actin and myosin proteins to parts, making a sarcomere. And a sarcomere is a structural and functional unit of a skeletal muscle cell. Now, the arrangement of myosin and actin proteins are responsible for formation of dark and light bands. The myosin protein shown in purple is responsible for the appearance of dark bands, which are known as anisotropic bands, and the part where only actin protein is lying is known as I band. Is it also called isotropic band? At the margin of the sarcomere, we can observe the actin protein binding to this structure, which is known as Z-line or Z-disc, and sarcomere is demarcated as the part which is lying between two Z-discs. Now, we can also observe that there is some part of myosin protein which is not overlapped by actin protein, especially during relaxation. That part is known as H-band, as this part appears less dark as compared to the rest of the dark part. And during contraction, when the actin protein slide over the myosin protein, the H-band decreases and the I-band decrease, but there is no change in the width of A-band. In this diagram, we can also observe the skeletal muscle as a whole here, and the fasciculi arranged in it, surrounded by the periosteum. Then we can observe one muscle fiber or myofiber. Zooming in the muscle fiber, we can observe here that it is made up of longitudinally arranged myofibrils. Now, zooming in further on the myofibril, we can observe the structure of a sarcomere, which is showing dark and light bands because of the arrangement of myosin and actin proteins. And we also observe the structure surrounding a sarcomere unit. Here in the skeletal muscle, at the level of Z-disc, a triad is formed. This triad consists of a T-tubule in the center, which is derived from an invagination from the sarcolemma, and there are two large cisterns of the adjacent sarcoplasmic reticulum, which are joining the T-tubule and forming the triad. So when the nerve impulse is passed from the surface sarcolemma to the T-tubule, it activates these large cisterns to release the stored calcium outside the sarcoplasmic reticulum in the cytoplasm, and then the myosin and actin proteins, they start the sliding filament mechanism. We end with the structure of skeletal muscle. In the next section, we will discuss the classification of skeletal muscles. So here are a few clinical terms related to the skeletal muscles. Paralysis is a term when the skeletal muscle are unable to contract as the nerve impulse is interrupted. That usually occurs due to loss of innervation, nerve injuries. The atrophy is the term used for decrease in the size of skeletal muscle due to disuse, and that is also related with nerve injury and a long-term effect of that. Then we have hypertrophy. Overuse of the skeletal muscle can lead to increase in the size of skeletal muscle cells and leads to hypertrophy, as in persons going to gym. And regeneration of the skeletal muscle and increase in the number of skeletal muscle is not a prominent phenomena. So regeneration in skeletal muscle is very limited. A few satellite cells present in skeletal muscle are able to partially regenerate after injury. Now the next term is dystrophy, which is usually an abnormality of the dystrophin protein, which is one of the binding protein responsible for formation of the sarcomere units. The binding proteins are important as they are responsible for the organization of the sarcomere units, and if they are not organized, the muscle will be weak, dystrophic, showing atrophy also. Then pulled muscles or strains may occur due to stress in individual muscles, and like commonly the sternocleidomastoid in the neck muscle is pulled. But generalized strain of the muscle is usually related to tetany or hypocalcemia. Then cramp is a sustained long duration contraction of muscle that is excruciatingly painful. Usually occurs in calf muscles, but it can occur in other muscles as well. So during injury, muscles can be torn. For example, you have studied in the lower limb that the hamstrings are torn from the ischial tuberosity at their origin. Thank you.